if we look at obsessive compulsive disorder from a depth psychology, psychoanalytical perspective, there has been a major change in how psychoanalysis has also looked at obsessive compulsive disorder. The earliest understandings of this disorder by Sigmund Freud and the school of ego psychology were something like this, that the person had an intense conflict with their sexual and aggressive impulses, that they used to really find their sexual impulses very unacceptable, or their anger and rage towards important others in their life as very unacceptable, and then they used to use defense mechanisms to deal with this discomfort. The defense mechanisms that they would mainly employ were undoing was a main defense mechanism, and in undoing, which also kind of explains various compulsions, the person has some kind of a thought or some kind of an unpleasant wish, and then they feel very scared by that, so then they do some kind of a magical action, which can be counting, which can be cleaning, and by performing that action they get this satisfaction that they are able to kind of clean that thought, or they are able to kind of get rid of that thought. Another very important defense mechanism in obsessive compulsive disorder is what we call the isolation of affect. It is a very general experience that when people talk to obsessive compulsive patients, they say that these people are constricted in their emotions, that they do not come with a very intense emotional feel to what they say. So the major defense mechanism used by them, which helps them to contain their feelings, is isolation of affect, where they are very much aware about the cognitive elements of what they are talking, but the emotional experience is not there. In fact, it reminds me, I once had this OCD patient who would come to sessions and would really talk about how painful and how difficult the obsessions were. But while he would be talking, there would be a smile on his face, and it's only very late in our work that we realized that this person was kind of feeling very uncomfortable with the emotions associated to the whole thing, and he was kind of avoiding them. In contemporary understandings of obsessive compulsive disorder, however, the focus has really shifted from inner conflict and from sexual and aggressive drives to other things. Now we understand obsessive compulsive disorder as something related to the person's entire self. Patients with obsessive compulsive disorder, they always seem to have this inner kind of a fear of what I would call like going to pieces or some kind of a disintegration, and they feel very scared of that. So in order to deal with this fear, in order to bind their self, they kind of get into these repetitive activities and actions. When they feel in control, they can get this kind of a reassurance that they are like intact and they are not going to pieces. So the fear of fragmentation of self is something that really underlies obsessive compulsive.